Hello, my name is Nivea Williams, and I'll be presenting on trauma informed counseling. And we're going to look at it through the lens of Black girls in predominantly white institutions. And so, in this conversation, we will discuss how we're going to integrate trauma informed model designed to support Black girls experiencing school based trauma, grounded in the cognitive process and therapy. This model integrates trauma informed school counseling and biblical care to address both cognitive distortions and systemic inequalities. Black girls' experiences must be understood within intersecting systems of race and gender, which shape their exposure to trauma and access to support. This presentation organized to move us. What we're gonna do is, even in this presentation, we're gonna kind of navigate through um the context of what trauma is in the school setting, what that lens looks like. We're also going to talk about the lived experiences of Black girls. We're going to talk about how those lived experiences translate into cognitive processing therapy, and how, as a school counselor, how would I use this new therapy within the school setting, and then how I could also infuse the Christian worldview. Now, that is a difficult task because, as you know, in school counseling, there is a separation of state and church. However, there is a way um, to use it and weave it in to the conversation and into therapy without it being glaring that we're using Christian principles, if that makes sense. So, as a school counselor, you're kind of the middleman within this space of therapy, and so it's important that we still maintain our ethical scope while also giving the students exactly what they need. And so, going forward, when we talk about trauma's overview and how we look at trauma when dealing with Black girls, you kind of understand what I mean by how we have to weave the Christian approach within the conversation and within the therapy setting. Trauma affects how students think, feel, behave, and often interfering with their ability to function in school. So, for Black girls, these reactions are frequently misunderstood and labeled as defiance instead of distress. This interpretation contributes to disappor- ugh, disappropriating disciplinary outcomes. Research shows that trauma related behaviors such as emotional reactivity and hypervigilance are often punished rather than supported. School counselors must recognize these behaviors as of need indicators of need and not misconduct. What that basically means is, like, as a school counselor, it's important for me to kind kind of look at a student and understand, does this student need to be disciplined, or does this student need a conversation? Do we need to break down what the real underlying issue is? And a lot of times for Black girls, those issues they feel like they're being attacked in some of these settings with some of their teachers or administrators, and the way that they deal with that could be combative. It could be received as combative. So, what I like to do in my approach is kind of talk to these students and give them different language to use and maybe different behaviors to use versus just the aggressiveness, or what is deemed as aggressive is really just frustration, because you're talking about young ladies who are perceived as aggressive before they even open their mouths, and that's not necessarily the case. They are passionate about how they feel about that, and sometimes in their skin is not received the way that it's being presented. And so there you have, we may have administrators who may look at these young ladies and say, well, oh, you're talking back, when all they're asking is a question of clarity, if that makes sense. Or they could be being dismissive in a question, what is perceived to be dismissive, and it could be an offensive question to that person. but because of that outside exterior, they're not getting the same level of understanding that their white counterparts are getting in some cases. And so trauma in the school setting often manifests itself as emotional dysregulation, cognitive disorders, or avoidant behaviors, all of which impact the academic performance. For Black girls, these symptoms are often filtered through the implicit bias, increasing the likelihood of disciplinary action. These patterns reinforce systemic inequalities in education. Trauma informed counseling requires recognizing how trauma shapes behavior and implementing support that address underlying emotional and psychological needs rather than the surface level conduct issues. So, in the graph, you will see that we're tackling the emotional, the cognitive, and the behavioral, physical, academic, how that impacts, how the trauma impacts the students and how they function. Now, I can speak to this because some of my students, um, for instance, you could have a young lady, two young ladies, white and Black, who've experienced some of the same trauma. For Black girls, and we'll say we have a student who's has a rough home life, right? And so for Black girls, that feeling of insecurity about having a rough home life, now you feel like everybody is out to get you. And when you couple that with the adultification of Black girls, and when you couple that with just the post-traumatic slave syndrome that Black women, that Black people experience, there's a different level of trauma that takes place when you're talking to Black girls. And it's important for us as clinicians to be culturally competent of these issues. And so, not to say that the trauma isn't this the trauma isn't the same. On the surface, it's the same, but when you dig down in deep to these different layers of trauma for Black girls and feeling unsafe at all times, you will understand how that affects their ability to learn and their ability to be successful students. When you have the individual trauma that you have at home, coupled with all the other layers of things, coupled with all the intersectionalities of things that they have to deal with. Black girls navigate trauma at the intersection of race and gender and school environments, which shapes both their experience and how others respond to them. These layered experiences often include cultural invalidation and systemic barriers. Describes home place. Kelly describes home place as a space where Black girls can experience safety, of affirmation, and resistance. Creating these environments within the school is critical. Counselors must intentionally support identity and belonging as a part of trauma informed care. I can say I in a few schools I've had that I've been at, I have a mentoring group, and one of the a part of this mentoring group is it gives girls a safe space to just be girls, right? Now the group is for all girls, but because I'm a Black woman, quite naturally those Black girls are going to gravitate to me as it's a safe space. And when we have these in-depth conversation in our mentoring program, it allows them to relax. It allows their nervous system to relax because their nervous system is at an all-time high throughout the day. Even I, as a Black professional in this school building, my nervous system is at an all-time high because I understand the environment that I'm in. And a lot of times I can put language to it, but our students cannot. Cognitive processing therapy focuses on the indiv- focuses on helping individuals examine challenging, unhelpful belief and developed after trauma. These beliefs can shape how students see themselves and the world around them. By learning to question and to reframe these thoughts, students can begin to regain a sense of control. CPT provides a structured way of support to process. In school counseling, school counseling can adapt these strategies to support emotional awareness and healthier thinking patterns. Um, we use in school counseling, we use a portion of this, but not to the extent of the therapy that the therapy describes. We're always um, presenting our students with changing the language and how they speak about themselves, how they speak about their coursework, how they speak about just things in general. And in doing that, you want to open their minds up to thinking differently about any given situation. And perhaps we do that. For example, I had a student come into my office today and said, I don't have any friends. I have a hard time making friends. Yet, and then they said that I'm an introvert. Well, with you being an introvert comes, you have to also be a little bit intentional about how you approach friendships. And so you can't be standoffish if you're wanting friends. And so you have to change your language. And maybe you're not an introvert, maybe you're an ambivert. You're introverted at times, but you also have this desire to be extroverted, and you have this desire to be in relationship with friends. And so quite frankly, I had a little biblical moment, and I told the student, if you want to have friends, you must first present yourself as friendly. And so in that conversation, it opened the students' eyes to understand that maybe I'm not as friendly as I'm presenting. Maybe I could be part of the problem, and it's not just people choosing not to be friends with me. Maybe it's some things that I'm saying, some dispositions that I'm giving off that is presented to other people as not being friendly. So that's just a small example of some ways that we can helps change students' language, and how we can integrate some of the Christian principles and Christian beliefs without crossing the line of state and church, and not making a big, well, the Bible says this. Because we can say things in the school counseling setting, but we have to present it in a way to where we have to weave it in there a little differently versus it being a strict Christian principle type experience or therapy session. Trauma disrupts the core beliefs related to safety, trust, and power and self worth, leading to the development of stuck points. These distorted thoughts reinforce emotional distress and maladaptive behavior. For Black girls, these beliefs may also be shaped by the repeated exposure to biases and cultural invalidation. Addressing these stuck points through structured cognitive interventions helps students reframe their experiences and regain a sense of control, identity, and psychological safety. Now, this point is interesting because although I this is one that I personally have felt it was a little difficult to kind of wrap my head around, because even though we're changing the framework of this conversation for some students, whether it be, just being hyper vigilant around men, for some girls, since we're talking about Black girls in the Black community, most of the times when young girls reach a certain age of puberty, we've been told that we have to cover ourselves and do all these extra measures so that we won't be viewed as adults early on when we're children. And that's part of the adultification of Black girls. Conversely, the point that I'm wanting to make with this is that the same conversation is not had with adult men, to not look at girls in that way. And so for us to be able to, you want to change the narrative of that conversation and kind of give woman her power back. However, that still does not keep them from not experiencing it. So for the stuck points, as we were talking about stuck points in this regard, that's a difficult task for Black girls because it is an ongoing thing that they just can't release. We can't walk through life and not be on guard like that, because that could be dangerous for us when it comes to some of these stuck points. So some of the stuck points that may come up in this type of therapy, there may not be a way for you to go around it. It may be a stuck point. This may be a point where you could change the language, but the trauma associated with it may not ever leave. And although that is the goal for cognitive processing therapy, is for you to change the way you think, it may be a journey to get there before they can really regain their power and control and things of that in that nature of as it pertains to that particular topic. School counselors are often the first to notice when students are struggling with their trauma. The role includes creating a safe space, offering support, and connecting students to additional resources when needed. Emphasis emphasizes that identity affirming environments are essential for healing. This places counselors in a key position to ensure that students feel seen and valued. At the same time, counselors must remain within their scope and collaborate with mental health professionals within when appropriate. Again, the role of a school counselor is very strict on what we're able to do within our scope of practice. And so therefore, like for some schools, what they've gotten to the point now is that they will hire out to get other therapists that can do a little bit more intensive therapy, and we use the referral system to do that. And by identifying what type of support the student needs, and it may come through several conversations with the student to where you're nailing down some of the core needs that the student may need. And you can't really get that in one conversation. Some students will come in and just say it all, and then you have some students where you have to pull it out of them and then use all your tools in your toolbox to get the story. And then when you figure out the story, it is best that you advocate for the student in whatever they may need, and then you refer that student to the appropriate source. Because at the end of the day, as a school counselor, my job is to be a change agent in your life and to ensure that whatever you need for you to be successful in life, creating a holistic student, that is what's most important. And if that is a point where I cannot serve you, it is my job and my duty to ensure that we get you the support that you need. The integrated model combines cognitive processing therapy, trauma informed school counseling, and biblical care to provide a holistic support. CPT addresses cognitive distortions, while school counseling provides the stabilization and access to resources. Cultural responsiveness ensures identity affirmation and faith support meaning making. Together, this model recognizes that healing for Black girls requires addressing both individual trauma and systemic inequalities within the educational environment. That's a tall task. That's a tall task. We may only get to a portion of that as we're talking to students and kind of building this space, because some of the systemic issues we can't tackle as one school counselor. That's something that has to be tackled, of course, systemically and systematically. And so it's a tall task, but you try to do it as much as you can. We can only push the needle so far in our field of study and in our scope of practice, but it's essential that we are pushing the conversation forward in some shape, form, or fashion. A Christian worldview emphasizes identity in Christ, renewal of the mind, and restoration. These principles align with trauma informed care by promoting healing and compassion and justice. The scriptures, such as Romans 12:2, highlights the importance of transforming the thought patterns, which parallels cognitive reconstruction in CPT. This integration supports holistic healing by addressing both psychological and spiritual dimensions of trauma. This integration allows counselors to address both psychological and spiritual dimensions of trauma, promoting holistic and healing identity development. Effective support goes beyond awareness and requires intentional action. Strategies such as psychoeducational cognitive reframing and identity affirming activities help students better understand their experiences. Small group counseling also provides a space for shared understanding and support. Highlight whole Highlight how culturally sustaining environments promotes both social, emotional growth, and academic engagement for black girls. These approaches shift the focus correction to empowerment. So when I had my mentoring group, the whole point of that mentoring group was to get them to change the way that they think about themselves. So in doing so, that was a small group. We could say that was a small group, and we were helping those young ladies to change. Just because you're from the environment that you're in does not mean that you can be successful. Just because you are a black girl does not mean that you can't be successful. It quite means literally the opposite. In spite of these things means that you can be successful, and you we did that through various measures by exposing them to who they could become, equipping them for their next stage in life, and then empowering them to, hey, you go after it. Um and so those intervention strategies, I've seen that they do work, and some things you should try. Applying trauma informed practices in schools require early identification, collaboration, and consistent follow through. Counselors must work alongside teachers and mental health providers to ensure students receive comprehensive support. Mays found that Black girls perform best in environments where their strengths are recognized and affirmed. This reinforces the importance of shifting from a deficit-based thinking to a strength-based approach that promote both well-being and achievement. Discipline disparities reflect systemic inequalities that disproportionately impact Black girls in school settings. These patterns are influenced by explicit bias and structural policies that prioritize punishment over support. As a result, trauma responses may be interpreted as misconduct. Disciplinary disparities persist due to systemic biases and interpretations of behavior. Black girls often overrepresented in disciplinary actions reinforces the cycle of harm. Addressing these disparities requires intentional reform and of discipline practices and trauma informed approaches that prioritize equity and student well being. I will give you an example of this. At my previous school, we had a dress code, right? We had dress code, and for dress code, you had to wear your shorts at a certain length. Well, some of the white girls will wear their soccer shorts and wear a large t-shirt over it, and so that would give the illusion that they didn't have anything on. When Black girls decided to do this same attire, they would never get dress coded. The white girls would never get dress coded for it. When Black girls started wearing the same attire, they were dress coded all the time, almost every day. Now, granted, even I would tell some of my Black students, hey, we can't wear that. You know, we thick in places that we don't need to, that we are, you can't avoid it, and so it shows up differently when you put some things on. And granted, some of their infractions were from people who do have some racial bias, both black and white. And a lot of times the biases from black women would come from the thought of them being the adultification of black girls. We see them as black girls, but the world will see them as women because of how they're developed, because of their development. And in doing so, we were trying to protect, but we could have caused more trauma and more harm. School based trauma and systemic inequalities can increase anxiety, depression, emotional suppression, and chronic stress among Black girls. These outcomes are intensified when cultural responsive support is limited or unavailable. Repeated invalidation may also shape how students understand themselves and their safety. School counselors must recognize these patterns, connect students to the appropriate support. Racialized trauma includes repeated exposure to discrimination, microaggression, and systemic invalidation. These experiences can create hypervigilance, emotional fatigue, and alter perception of safety. For Black girls, racialized trauma may also intersect with gender, expectations, and school discipline patterns. Recognizing these layered effects helps counselors respond to cultural humanity, help counselors respond with cultural humanity and trauma informed care. A sense of belonging plays a role in how students engage and succeed in school. For Black girls, this sense is often disrupted in environments where their identity is not fully affirmed. Kelly explains that spaces rooted in affirmation are, and care help restore both confidence and connection. Without these supports, students may internalize negative messages about themselves. Counselors must be intentional about creating environments where students' identity is not just acknowledged but valued. This is extremely important. Most black girls or most black students that are at predominantly white schools, they don't feel seen, they don't feel heard, and they don't feel valued. Now, sometimes that's different depending if they're in extracurricular activities, because what we have noticed is that for Black boys, it's easier for them to be seen, valued, and heard because of their athletic ability. Sometimes it's not always the same for Black girls. A trauma informed case example may involve a student with behavior changes, repeated repeated discipline referrals without a trauma informed lens. These behaviors may be misread as defiance. Emotional distress and cultural factors may be overlooked, limiting appropriate support. Recognizing these patterns allows school counselors to respond with empathy, provide support, and facilitate referrals to appropriate services. Traditional discipline practices often respond to behavior without considering its root cause. A trauma informed approach shifts this perspective by recognizing behavior as communication. When schools move away from punishment towards support, outcomes improve. Restorative practices and cultural responsiveness approaches create opportunities for healing. Kelly reinforces this environment ground and Kelly reinforces that environments grounded in care and affirmation can interrupt cycles of harm and promote long-term growth. Advocacy is a critical responsibility of school counseling. It is what we do. We are your students advocate. We advocate for students every single day, good, bad, and indifferent. When addressing systemic inequalities that impact Black girls, this includes challenging policies that contribute to the disproportion, discipline, and working to amplify student voices. Collaboration with educators and administrators to essentially is essential to promote equitable practices through intentional advocacy. Counselors can influence individual outcomes and broaden systemic change. This is one of the things that we find most difficult. We're often as school counselors finding looking for ways that we can improve and make change for our students. Change in systemic things are what keeps us up at night, because there's some things that we know needs to be changed, but the system does not give room for growth, and if it does, it's for a little bit of growth. You can have growth in your pocket of the world, but systemically it is what it is. And so having to navigate that and work within the system is very, very difficult, for myself and some of my counterparts. Healing does not happen by chance. This requires intentional support and consistent care. Students need environments that nurture their identity, relationships, and emotional well being. King emphasizes that cultural responsiveness spaces support both development and resilience. For Black girls, healing is strengthened when they feel supported, not only academically, but also socially and emotionally. Counselors play a key role in helping students move from survival to growth. I cannot stress enough how we we go through this transition of healing probably daily, or for some students it may happen over the course of 4 years. And so this is kind of the roadmap that we use for healing. We're doing CPT without it really being said CPT, and all the things and how we interact with our students. It is foundationally CPT, but we're not in the space of conducting it as a licensed therapist would. But we do all these things. Trauma recovery occurs in phases, beginning with safety and stabilization before deeper processing can occur. Students cannot meaningfully heal when they feel emotionally and physically unsafe. This framework emphasizes regulation, support, and identity restoration. In school settings, school counselors support readiness by creating predictable, affirming environments and connecting students to licensed providers when clinical treatment is needed. Cannot stress that enough. It is my job to give you a safe space so that you can say what you need to say and we can tackle the trauma. And if it's out of my scope, I must refer it out. What we have learned in this space of school counseling, you do more harm than good if you begin to work out of your scope of practice. And for me, I never want to do educational harm, but I especially never want to do emotional harm to any student. And so we take this part very seriously. Identity restoration is critical when trauma and cultural invalidation distort self worth. Black girls may internalize negative messagings within their experiences, are dismissed or misunderstood. Strength based practices help challenge these narratives by affirming culture, voice, and belonging. School counselors and can support healing by naming strengths and building environments where students feel seen and valued. Healing is not just an individual process, it is deeply connected to community. It is deeply connected to community. Family, peers, and school climate all influence how students recover and grow. Mays highlights that supportive environments contribute to confidence and success amongst Black girls. A liberation focused approach recognizes these connections and works to address the broader systemic barriers. Counselors must collaborate across systems to create spaces that uplift and empower students. Faith can also be a powerful source of strength, especially during difficult experiences. It provides a meaning, it provides meaning, encourage hope, and supports emotional regulation. For many Black girls, faith communities function as a space of connection and affirmation. Kelly suggests that environments grounded in care and belonging, healing and meaningful support healing in meaningful ways. When integrated thoughtfully, faith can complement counseling practices and contribute to the holistic well-being. I cannot agree with this more. Even as an adult, I have healing circles or I have sister circles with my friends to where we can go and express ourselves and be in a safe space to say and just to be. And Black girls need those moments to just be and exhale and give their nervous system a reason to relax. Biblical principles emphasize dignity, justice, and compassion, restoration, and hope. These themes align with trauma informed care because they affirm the worth of those who have been harmed. Christian integration should not minimize suffering, but should support healing through presence, through truth, and through advocacy. This foundation strengthens the model by connecting psychological care with spiritual meaning. CPT and Christian worldviews share a common focus on transforming the thought patterns of cognitive reconstruction. Cognitive reconstruction. It also encourages individuals to challenge harmful beliefs while scripture emphasizes renewal of the mind. Together, these approaches both emotionally and spiritually heal. They work as a package to spiritually heal some of those spaces of stuck points that a student may have. This integration allows counselors to address deeper questions and identify the purpose while remaining grounded in practice, while remaining grounded in evidence-based practice. The result is more holistic approach to care. Resilience is developed through intentional support and skill building and access to protective factors. For Black girls, resilience is often shaped by navigating systemic challenges and cultural censors, support systems, identity, affirmation, and coping strategies strengthen resilience over time. School counselors play a key role in fostering environments that promote adaptive coping and long term emotional stability. School counselors' implications include cultural humanity, trauma recognition, ethical referral, and systemic collaborations. Counselors must recognize that students' distress may be connected to both personal experiences and institutional harm. Supporting Black girls requires affirming dignity while remaining within your professional scope as a school counselor. Collaboration with families, educators, and licensed providers strengthen care and improve student outcomes. Ethical practice requires school counselors to remain within their scope while still responding to the student's need. Counselors should not provide specialized trauma treatment unless appropriately trained and authorized. Instead, they can identify concerns, stabilize the student, advocate, and refer for clinical care. Cultural contact must also be respected and avoid minimizing and mislabeling student experiences. The key findings show that trauma among Black girls is layered, systemic, and deeply connected to identity. CPT provides a structured framework for understanding the maladaptive beliefs, while school counselors support access, advocation, and stabilization. Cultural responsiveness and faith integration strengthen the model by addressing belonging, meaning making, and resilience within the broader healing framework. These discussion questions encourage reflection on the model's major themes. Participants should consider how trauma, discipline disparities, cultural invalidation, and faith integration intersect in school settings. The goal is to not only understand harm, but to also identify reflection, practical responses. Reflection help connect research to counseling practice, advocacy, and ethical belief and ethical support for Black girls. Systemic change requires intentional examination of policy and practices that disproportionately impact Black girls. Discipline systems must shift from punitive approaches to trauma-informed and restorative models. Addressing implicit biases is critical because it influences decision making and student outcomes. Sustainability change requires accountability and leadership, commitment, and ongoing evaluation practices, of equity practices within school settings. This is extremely important, especially if we're going to address systemic change. And that's what makes our job so difficult because it is hard to do this when the other layers are not addressing it as an issue or never see it as an issue to reform it. School counselors serve as change agents by addressing both individual and systemic factors impacting students. Their roles includes identifying trauma indicators, providing safe spaces, and facilitating referrals for specialized care. Counselors are influenced school Counselors also influence school culture through advocacy and collaboration. These responsibilities help to ensure trauma informed and cultural responsive practices are implemented effectively across the school system. The final model integrates cognitive processing therapy, trauma informed school counseling, and cultural responsiveness, biblical care, and advocacy. CPT provides a structure for understanding maladaptive belief while school counseling supports stabilization and referral. Cultural responsiveness affirms identity, faith, and support meaning making and advocacy, addressing systems inequalities. Together, these components create a holistic, trauma informed model for supporting Black girls. This call to action emphasizes the responsibility of counselors and educators to address the systemic inequalities with intentionality. Supporting Black girls requires trauma informed practice, cultural responsive care, ethical referral, and policy advocacy. Faith integration should be used carefully, respectfully, when appropriate. Sustainability, Sustainable change occurs when schools commit to both student support and systemic transformation. And this faith based reflection emphasizes hope, restoration, and justice and identity. Christian integration should affirm that suffering is seen and that healing includes both compassion and action. Biblical care supports meaning making and particularly when students and family values spiritual response resources. When used ethically, faith can complement trauma informed care by strengthening identity and resilience. In conclusion, trauma informed care for Black girls must address both systemic inequalities and individual experiences. CPT offers an evidence based framework for understanding maladaptive belief while school counseling provides a support through advocacy, psychoeducational, and referral. Cultural responsiveness and faith integration strengthen the model by supporting identity, meaning making, restoration, and meaningful change begins with intentional action. I hope you enjoyed this presentation. When dealing with this subject matter, it's a lot of work to do. Um, it's a lot of work. It is a work that's necessary because we want to get these young Black girls who are experiencing this type of trauma to a space to where they can think highly of themselves and want to go on and pursue their dreams. I thank you for joining me.